So as we come to the penultimate stages of this multi-segment, multi-part presentation, MERC has often used this terminology apex body during the course of the presentation in multiple at various stages. The Surgical Society of India is envisioned as a body under the Union Ministry of Health, whose vision or primary function is to promote the highest standard of surgical education and surgical practice in India in all institutes, medical colleges and hospitals that offer surgical residency courses in various specialties and super specialties. Also to promote the highest standards of surgical care and surgical treatment to the patients in every hospital across the nation by striving to enhance the very surgical skills of a surgeon through various methodologies, beginning with a process of accreditation and finally by a process of periodic surgical audits as discussed before. So in front of you is the slide about Surgical Society of India under Union Ministry of Health. I repeat, as I always say, that this is a vision. We are civilians. It is up to the government and obviously the concerned ministries to, and as I say, a vast number of learned faculty and senior consultants and surgeons all across the nation. It is for them to go through this, to go through this proposal, and if and only if they find merit, would implementation be possible. We now come to the functions of the Surgical Society of India, which is displayed on your screens. 1. Surgical education, that is postgraduate and super specialization, both broad specialty and super specialty. As we already know, creation of a national surgical logbook, the stipulating the type and number of cases to be done by every surgical resident by the end of 3 years, a 6-monthly video conferencing and interacting with the PGs and faculty and redressal of grievances, 6-monthly video conferencing and interacting with the surgical faculty, mentors and head of departments to ensure that the PGs are disciplined, hardworking and committed to their work, providing periodic feedback and formal reports to the heads of the institutes and to correct the deficiencies and lacunae in PG training, submitting formal report to the Ministry of Health and National Medical Council regarding progress and deficiencies in the training program all across the nation, and monitoring of the conduct of final exit examination both at specialty and broad specialty level. Next, promotion of surgical skill by way of SSI accreditation, Surgical Society of India accreditation. The slide is in front of you. Individual accreditation based on operative case demonstration, level 1, level 2 and level 3. Department level accreditation based on the annual surgical audit. Departments as a whole would be accredited for a given particular academic year. Continuing surgical education program, just like our continuing medical education program, which we call it as a CME. SSI would be instrumental in continuing CSC programs where the emphasis would be mainly on a diffusion of culture, surgical culture, academic culture, technical culture between the various institutes that are present all across our nation. That is to say that a particular given institute every year would do well to invite guest surgeons as a team who perform their own e-honor and their own complex surgeries or whatever it is. This team, the faculty, especially the postgraduates, the lecturers, the assistant professors, associate, the junior and the middle order faculty, they would do well to assist this team and thereby learn newer techniques of surgery. So this is what is envisioned as continuing surgical education. And lastly, the promotion of excellence in surgical treatment by way of annual surgical audit. So post-annual surgical audit, the SSI would, that is the Surgical Society of India, which is, I repeat, an envisioned body, would give a seal of accreditation, which would be known as Surgical Society of India post ASA, Annual Surgical Audit Accreditation. With this summary of accreditations, what is the use of accreditation? What are the advantages of accreditation? Just now we have discussed. But as regards to the patient, ultimately, all these exercises, these so-called exercises, the ultimate aim, the core is patient care. The ultimate aim, the final aim is that all these things, whether it is better surgical education for the postgraduates and accreditations for the degree holders, the surgeons, whether it is annual surgical audit, whether it is continuing surgical education programs, departmental accreditation, wherein the department as a whole, the audits, the results are audited. If there are any discrepancies, mutually the surgeons can get together, no matter if, even if they are in different units. It is envisioned that these audits help in the surgeons getting together as a team and complementing each other by assisting each other in certain complex cases or whatever it is. Ultimately, to put it in one line, it is to iron out the deficiencies, lacunae, and whatever are the negative factors. All this, how does it help? Ultimately, it helps the patient, because better the surgeon, better the technical outcome, greater will be the benefit to the patient. Not only that, accreditation helps the patient in choosing his or her surgeon or doctor. Every patient has a right to access the best of the healthcare. Every human being is equal. Yes, somebody may take a deluxe ward, somebody may take a general ward, but the surgery that is performed, that is uniform. And the best of the treatment, obviously, would be when the surgeon technically is very strong. And all these are the processes by which a surgeon can evolve as an absolutely strong technical professional.